Good morning. I'd like to welcome everyone to this hybrid meeting of the Adults and Communities Overview and Scrutiny Committee, which is open to the press and public. The meeting is being broadcast live, and the recording of this meeting will be available as soon as possible after the meeting has concluded. Please be aware that this meeting is being transcribed only for the purpose of producing the minutes. This transcript will be leaked. The committee has approved the minutes. The transcript should not be downloaded by anyone other than Democratic Services. We welcome the use of the Welsh language at meetings. I've had no requests for people to speak Welsh today, so this meeting will be conducted in English only. Please can members refrain from using the chat function and instead use the raise hand icon to indicate when you want to speak. May I remind members that as per statutory guide made under section 4 of the Local Government Wales Measure 2011 and our formally adopted hybrid meeting policy, any member attending a meeting remotely must be able to be seen and heard by the members and officers who are attending the meeting, as well as by members of the public viewing the meeting. So can I ask you all, please use your cameras for the duration of this meeting. Please remember to keep your microphone muted when you are not talking. Please do not interrupt discussions until you have been notified of your intention to speak and you have been invited to do so. So moving on to the agenda. Agenda item 1, welcome and apologies. Niall, do we have any apologies today?
We haven't received any apologies, Chair.
Thank you. Agenda item 2, declarations of interest. Members, do you have any declarations regarding today's report? Thank you. Agenda item 3, minutes of the meeting 19th of March 2026. Members, please could you state whether you have anything to raise in relation to the meetings from the meeting held on the 19th of March 2026, where the committee received the report on third sector major grants. If not, I will take them as agreed. Okay, agenda item 4 is the action sheet. If I hand over to Rebecca, could you run through that with us?
Thank you, Chair. So there was only one action outstanding on the action sheet. That was regard to receiving the responses to the recommendations from that last meeting. I have sent those out to you earlier this week, so you have all now received those. Thank you.
Thank you, Rebecca. And before we commence discussions, I would just like to welcome Councillor Fiona Cross, Executive Member for Communities, and Beth McPherson, Head of Communities and Wellbeing, Simon Rose, Group Manager of Housing and Prevention, Kelly Walls, Prevention Hub Team Lead, and Councillor Daniels, Executive Member for Adults and Housing. So good afternoon, everyone. So before we open to questions, on behalf of the committee, I'd like to thank Simon Kelly and the EIP Hub for hosting some members of the committee on the visit on Tuesday morning. Members found it extremely useful to speak with the team to gain a better understanding of how the EIP is operating. So please pass our thanks to the wider team. Okay, members have gone through the report and prepared a set of questions. Would councillors or any officers like to make any introductory remarks before we go into questioning, or are you happy to lead?
Just very quickly, I won't go through the report verbatim. Really just picking up on the visit that was done the other day, the team found that really useful to speak to the members that attended and gained a lot from that in terms of the questioning that's there. One thing, just as a prelude to the questions, and I'm sure some of this will be teased out, is very much around that this is an evolving beast. This has taken a significant amount of work and effort to get to the point where we are. And while some of the information here tells a story, does it tell the full story of what's gone on? It doesn't really, because that would take an inordinate amount of time to work through exactly what's transpired and what we're currently working through and what we need to deliver and do. So with that in mind, I'll open the floor, I guess, for the questions that you then have. It just sets the scene for where we are.
Thank you. Okay, the first question is relevant paragraph 3.1. The delivery of the Early Intervention and Prevention EIP model commenced in June 2025. Can you give us further detail on how the hub was brought together?
Okay, I'll pick up on that one firstly, and then if there's anything that Beth wants to pick into, or Kelly, then they'll correct me where I get it wrong, no doubt. The staff team was brought together on the start of April, and it was very quick to build the team and the model up from there on in. So it was a way in which it was brought through the restructure and realignment of services across the whole communities division, and it brought together a range of staff from a range of different areas, were brought into the hub, all bringing in different skills and different attributes into the role, and were shaping that. There was a period of time from April to June when we were working on the different models of delivery, how we would be recording the data, how we would be taking referrals, how we would be measuring the outputs and impact of what we were delivering and doing. And that shaped the information that we have today. Essentially, in terms of how that operated, that was a combination of individuals expressing interest to come and work in the hub through that restructure and realignment, people slotted directly into roles, and alignment of where different responsibilities and duties lay in terms of the officers that were overseeing that service. So it's very much a collective and joined effort, not just within the EIP hub, but across the whole communities division, that everybody shaped that in terms of how it would be working and fitting together and learning about what was there. So in terms of that real delivery and that mechanic, the first few weeks were a little bit like a helter-skelter, a little bit harem-scarum. We were unsure as to what we would see, what we'd be getting through the door, the type of inquiries we'd be getting, and very much really learning from everybody's experience there and shaping how we evolved and how we evolved those procedures. I think in many ways, it's really enabled those staff to develop a massive amount of resilience and inner strength in terms of how they're dealing with situations that they arise now. And I think without that prelude, that 3-month gap of building that team and building that strength and that sense of collectiveness, I don't think the service would be as effective as it is today. And I think whilst there's still areas that we need to develop and evolve, I'm immensely proud of the staff that have come into that arena, because they've really stepped up to the plate and really grabbed the bull by the horns and really, what I would say is almost proven that we've got some exceptional talent within the council, not just within that team, but within the other teams that are feeding that, and not just within the council as well, but beyond that in terms of the other services that we commission with, and some of the community activities and groups that are there. I cannot praise them enough. I'm absolutely blown away by the work that they do on a volunteer basis, day in, day out, week in, week out. And that's what's making the difference. And it's how we build on that from now on in. Does that answer the question?
Thank you. Next question, Councillor Steve Evans.
Thank you, Chair. Let me just say I visited and I was well impressed. And with the person I spoke to, the knowledge and the answer of every question I asked. So thank you from me. The question I got is, how does the work of the EIP hub and the wider EIP agenda feed into the deal, and also the potential benefits of working within the Federation?
Okay, I think at the very core of the early intervention and prevention agenda is how we work with communities and how we deliver a different response through a different mindset of working. And what we found through the EIP work at that central point of the hub, and also in line with the way in which services are structured and delivered on the ground, is very much at looking at what matters to individuals who walk through the door, what's really critical to them at that particular point, and us not as professionals dictating what individuals need. We will have a view, and we will help to shape that view in terms of what people need to be addressing and how we can work with that. But sometimes people have got a different slant on that. Sometimes what matters to them now is not really what matters possibly in the long term. We need to unpick something first before we move on. So I think in terms of how this links to the deal, it's very much a change in mindset in terms of how we're working, how we're communicating differently with people who are presenting to the front door, and how we're finding different solutions. And what we're doing is we're not just using one tool in the kit bag, because, as outlined in the report and one of the appendices, there's over 46 services that we refer on to in terms of the EIP work. That's a significant amount of resource that we've got to direct people to, and that's not just then a one-trick pony that used to be there in terms of somebody dropped at one front door, we're referring to one certain service. We're able to amalgamate that to actually meet the needs of individuals that are there and their wants. Now, in many instances, some of the wants that they want, we can't actually meet them because the services aren't there, and that's where we're able to build that up and then link into the premises of the deal to look at how we actually work with communities to develop things differently and shape those communities in the ways in which they wish to move. They're the ones that know what's needed. They're the ones that know what they need to be delivering in those communities. And whilst as officers we will have views, and whilst as a council we will have views, the paramount thing is that we listen to communities in terms of how we deliver those outcomes and how we support them to be effective. And that's the one thing that we've been able to sort of drive in terms of EIP as a whole. And I think that's at the cornerstone of the deal.
Thank you. You also answered the next question for us as well in the reply, so thank you very much. So we'll move on to... Oh, Councillor Hall, would you like to...
Morning, everybody. First of all, I'd like to say thank you to you and your team, especially the person I spoke to. It gave me a massive, big insight to the pressures and strains of the day-to-day operation within it, and obviously the conversation that we had afterwards. I think it broadened the expertise of what you do within what we do, and that was very gratefully received. So, going on to the question, because that's what we're here for. Critically, this is about 3.2, so critically the view model is a delivery of work within the communities to develop resilience services and how these can be shaped to evolve to meet the local needs. So my question is, how are we developing the services that delivers on the local needs whilst shifting from cultural perceived expectations or wants from individuals? We are seeing changes, we are seeing different people wanting different expectations. The expectations are getting harder to expect. And if that makes sense, so where are we on that? Thank you.
First and foremost, I think what we're able to do, and I touched on it a moment ago, is that we can see the whole need and spectrum that's coming in from individuals in those presentations we're seeing. And you saw that on the visit in terms of the types of enquiries we're getting. It's absolutely massive. What we're able to do in terms of that is identify where we've got gaps in services when needs are coming through from individuals. So, for example, we're seeing gaps in and around community transport. Is a broad one we're seeing, that people are struggling to get out to groups because the community transport is not as accessible for some, particularly those with mobility issues, and that's causing a little bit of a barrier for people engaging in community-based activities. Other things we're seeing on the ground are things that are fed in from our community capacity builders and our community teams in terms of what we're seeing there. And again, that's feeding in to how we're then developing the different mechanics to get funds out there to communities to actually tackle some of those needs. And what we're doing on the ground is actually having an open dialogue, excuse me, with organisations to shape that vision and shape the work that they're doing. That, for me, is a fundamental cornerstone, again, of how EIP is working, because it's that top-down and bottom-up approach. And in the middle, that's where we're making the difference, because we're able to then see the wider strategic vision that the Council has in terms of fostering that view and how we're shaping that using the funds we've got available, and how we're getting communities to work with us effectively in line with the core principles and missions of the deal to actually really deliver on the ground and make that difference. And I think fundamentally for me, what we have is an ability to capture that information now in a more robust way, and how we then link that to the groups on the ground in terms of what they want to do and deliver, and to help them to access alternative funding streams as well for innovative ideas that they've got. What we've been keen to do is really get our capacity builders there out in the community to actually be shaping some of that work. And it's not just within the community groups, it's within the school setting as well. So it's almost looking at how schools feed into the local community as well and what role they play in terms of shaping the future individuals who are going to be part and parcel of the society going forward. And that's a whole systematic change and generational change that I won't see in my working lifetime, but young people are hopefully going to come through and shape that vision going forward.
So we'll talk about funding. So the external funding that we're having now, so you're obviously recognising that there are different needs. How easy is it to get that external funding to be able to help those external needs that you're actually identifying?
Getting any funding is an art form, and there are some very good bid writers. There are some very poor bid writers. I would class myself in the poor bid writer category myself, but it's very much an art form, and how we support groups to access that external funding that we can't get as a local authority and some other partners that we have can't access, but how the voluntary sector can access that and how we help them deliver that and get their hands on that funding is how we'll keep that lifeblood going and how we'll keep them ticking over. And that for me is that role within the capacity builders that we've got within EIP to deliver those outcomes and those differences and those challenges there. Equally, we've got to be very canny with the funds that we do have as a council in terms of how we blend them together. And that's the one thing that EIP has done, has brought a number of funding streams together, and they're combining where there's that connectivity across services. So elements of the CCG grant and housing support grant, for example, there's so much crossover with that. It almost seems almost like natural that those should be joined in certain ways, particularly when you're looking at working with complex families or families with particular needs and issues. There's so much synergy there in the work that we do that we've missed opportunities in the past, and what this is doing is actually picking up on those opportunities now, which for me would probably help with how we're accessing that overall funding pot and making every pound count that's there, because it's getting more and more tight.
Beth, did you want to come in? I noticed your hand was up. Did you want to come in, Beth?
Yeah, I think probably just on Councillor Haller's first point where part of the question was around sort of managing that expectation that's presenting currently, and I think that's just an important point in terms of early intervention prevention to highlight that actually there's two strands almost to this conversation, because there is the demand that's presenting now, which is probably closer to that acute end. And how we manage that is, more difficult. What is important, though, that we don't lose sight of that earliest intervention and building that sort of depth of provision within communities and at a lower level. So through the hub and through the communities team, we are sort of almost dual tracking two strands of work, which is what's presenting currently and that level of need there, whilst also making sure that we are building that longer term programme of support. So just wanted to add that element in. And I think critically on funding as well, the advantage potential that we have, from the conversations we've had with communities, is sometimes they can deliver more efficiently with less. It doesn't mean with nothing, and we would never expect communities to deliver with nothing, but actually they operate in a much more agile way sometimes than we do as a council, which does give benefits in terms of supporting that delivery. So how we can potentially use our own resources moving forward to underpin that link to the deal is another important consideration that we're looking at.
Thank you, Beth. Next question comes from Councillor Clarkson.
Hi, thank you, Chair. I think Simon's explained some of the information I was looking for. I was looking on how we were identifying gaps, but I think Councillor Williams' next question might draw out some more information that's relevant.
Thank you. So yes, it was really sort of, and I'm not looking for the one-word answer necessarily. Where gaps are identified, are you in a position to commission services, or if not, how does that get taken forward?
Okay, in terms of the commissioning angle, we're working through the approach we're taking. We're working very closely with groups around that, and we've undertaken work over the course of the year in terms of looking at the use of funding that we had through progression grants. That's now coming to a close now, so we're closing that programme off. And that's given support to, off the top of my head, around about 50 or so different projects across Torvine. Really impactful use of funding there to actually underpin the work that's been done to improve facilities, through some capital works, What we're keen to do is have continuing dialogue with groups across Torvine in terms of how they see services shaping, what initiatives and ideas they have. That gap analysis is critical for us, and how we actually gather that information from a range of different sources. So very much we're keen to establish a mechanism for doing that in a much more structured way, but also having that, if you like, that anecdotal information coming forward, where there's stuff that we're seeing on the ground. So we're starting to pull together some processes there within the commissioning team, preventative commissioning team, in how we do that with our capacity builders and the community groups that we have, and also looking at how we engage with wider stakeholders in the mix here, because I strongly believe and firmly believe, and people have heard me say this before, that there are funders or other organisations working across the public sector who potentially need to be brought into the EIP agenda and come forward with funding there to underpin some of the work that's done within communities and that we're doing here as well. I think if we're doing things in isolation, we're going to be doing them wrong. The important thing is that we're doing this collectively and collaboratively. The approach around commissioning is one that we've still got to work through fully, because very much over the last year it's been settling the service down, getting to a point where we understand where the money is and how that's structured and what we have. And the problem we have with some funding streams is that they change so frequently. So SPF has finished, we now have another grant stream. Housing support grant is done on an annualised basis. CCG is done on a 3-yearly cycle. So we're never quite sure what the funding is going to be year on year. So that is difficult to plan. But we have a very strong team in that commissioning arm that are very good at juggling that finances and moving the funding to the right places. Equally, around looking at access to funding, as I picked up earlier, it's important that we support those groups to access alternative provision that's there. And as Beth said, they can mobilise much quicker than we can.
Can I just quickly ask then, are you willing to share that information you have? Because obviously sometimes not supporting bids from organisations, you need the evidence. And sometimes you will have the evidence that they may not have. So presumably that is one of the ways forward, that you'll be able to share that evidence of sort of numbers and things. I know how important that is in going for grants. And a yes is fine.
Yes, absolutely.
Okay, Beth, then do you want to come in?
Yeah, just really quickly, I think, and there's two ways potentially, well, there's lots of ways we can do that, but two ways that we've kind of considered. One is around how potentially we could almost pull like a dashboard report, maybe on a quarterly basis, that would give that narrative around those gaps, etc. And that would allow us to push that out into those community networks to say, actually, these are the emerging trends that we're seeing. Some of it, I think, needs to be longer term than that as well. You know, things like the NEETs agenda. We know communities have an appetite to sort of step into that space, but maybe not yet. So it's making sure we've got that sort of full planning and to do so. And then that's a critical part of the community capacity builders work in terms of linking with the prevention hub. The prevention hub uses the data to help tell us where the gaps are. The community capacity builders then mobilise that with the community groups, go out there and actively have those conversations. So I think there's a couple of strands in which we can achieve that and sort of deliver that information to groups.
Thank you. Next question comes from Councillor Horler.
This is about 3.3. And some big words in here for me. So the EIP model provides a coordinated and cohesive response that addresses this and focuses on directing people to the right support. So my question is, what has improved in terms of the coordination and cohesion since establishing the EIP model? Thank you.
Putting it quite simply, we've been able to look at the services that are there and make the best fit. And what we've been able to do is not duplicate effort and provision, because in some instances there was evidence to say that people were getting support from multiple different teams. Not just within the council, but across different areas. So there was miscommunication, there was a lot of wasted effort, a lot of wasted energy. And what we've been able to do is actually really drill down, as I said earlier, that what matters to individuals. We've been really able to unpick, and some of the case studies show that, how we can elicit a different response, where we potentially in the past have funneled people down a certain route because of where they presented, the EIP model's able to look, and the team are able to look now through the skills that they've built up, at a better way of delivery. And it's not just looking at one of the commission services that we refer to, but putting a model together that actually looks at community-based support as well, so that there's an element of there of looking at how people are softly exiting services and are going out into the community, and it's hopefully then improving that resilience. So in a way, it's how we've been able to look holistically at an individual's needs and make sure they're going to the right place, but also make sure they're not going to too many places, because that was happening before. And I think it will still happen at times. I don't think you're ever going to get away from people going to organisations in the community independently and accessing different services that are there. And it's about how we actually use that intelligence and that information. And I think Beth touched on it. If we're able to share more information around what's happening, how we're communicating with individuals, and be able to actually look at things in a wider picture, in line with the thinking behind the deal and the mindset behind the deal, then we're going to have more impact then for individuals and more resource and resilience then in terms of how we're delivering services.
Sorry, so is it fair to say that individuals now have more cases, or you're more focused on their needs on a day-to-day basis? Going through, you're more focused? Is that fair to say?
I think it's fair to say that. I definitely think there's more focus on what those key outcomes are and what we're trying to deliver against those themes that are within the report there, and what we're trying to prevent. And that's really honing in on what we need to do and what we've got to sort of address in terms of meeting those needs and stopping those, if you like, those critical negative outcomes that people face.
Thank you. Oh, sorry. Oh,
I was just going to say, I think the biggest thing that we've seen, the feedback we've had from people that we speak to, is that they feel listened to. So because they're coming through to the hub, sometimes it's just that conversation gives them the confidence then to go and do things themselves. So whereas before maybe they've gone to several different areas, it's one place where they're very highly skilled people, as you know, and they can then direct them rightly, but actually give them that, intrinsic knowledge that they're doing okay actually, and they can do this for themselves. So we've definitely seen improvements with some of our individuals coming through.
Councillor Horner.
Yeah, I've got the next question. This is about 4.2.1. Support provided is varied and a wide cross-section of providers' provisions to meet the needs of individual presenting. How difficult is it to manage the variations of support that are needed? Ooh, sorry.
Kelly may well come in on one or two bits here from an operational angle in terms of how you manage the different teams and the different dynamics and different ways that people operate in. I think what has been a challenge going forward is how we've developed the system for referrals and getting the outcomes and outputs and making sure that flows. And I think at the very early stages, it involved a lot of effort and energy on our part across all the teams. Not just those internal, but also externally commissioned that were coming to the table, to actually make sure that they were following the script and following the process, so that we could have that rich information. I think that's taken months of what I call almost blood, sweat and tears to get to that point where we're more confident with the systems being followed. The problem we have is that different services, different provisions have got different funding streams that they're coming from and different requirements, and that's a real issue when you're looking at some of the outcome measurement. What we've had to do is actually give a little here and there, try and make it work, pull it together, but have a common golden thread running through it, and that's where we've used the IT systems and solutions and the methods that we've had in the background to actually coordinate that and bring that in. What we've been able to do is shape that with those different teams and different organisations that are there to get to the point we are today, where we've got much more confidence in that being followed. But it is like anything, everybody's got their own pressures in terms of that service delivery that's on the ground, and we're there in the middle almost trying to coordinate that, and that is heavy work at times. There's a lot of heavy lifting there to guide people through and to provide that reassurance as well. But I think we're in a much better place, significantly better place than we were 3 months ago. And certainly when I look back to the start of June, when we started out, that harem-scarum element is not quite there now. There's still elements that we've still got to pull through, but it is a real challenge. But it's really, I think what we've put ourselves is very much ahead of the game and thinking very differently about how we operate in this space. And we've had a lot of interest from other local authorities who have asked us questions about how are we doing this, how are we delivering this, what does this mean? So hopefully, from a Torfaen perspective, you know, our experience will help others sort of hopefully shape a similar sort of approach and agenda going forward.
So when we had our chat on Tuesday, it was obviously a progression of where we were going to move on and expectations on how we were going to progress this. I think we've always thought that we've got a learning curve of where we're going right now, the expectations of the long term. But this clearly demonstrates to me that you're actually moving in the right direction, and it's going to get, over time, it's going to get better and better and better until you've got to a pinnacle. Thank you.
Thank you. Next question, Councillor Slade. Can you put your microphone on, Councillor Slade? Thank you.
Sorry about that, schoolboy error. My question refers to paragraph 4.4, which says, to provide greater context and drill down to the support that can be offered to prevent and intervene before a crisis point, such as homelessness arising. So I appreciate that we're still at the early stages of implementation, but how far off do we think we are in terms of delivering more earlier intervention activity before a case reaches referral stage?
I think this is a tricky one, really, Councillor, because there's a lot of early activity that's gone unseen, and we don't really know the full extent of what is being done in advance of that, particularly in community groups. I'm fairly confident on what I've seen when I've gone around different groups that they're actually keeping a number of people away from the front door and the frontline services. But in terms of measuring that, where we were and where we are now is difficult to equate at this particular point in time. We do know that we are referring more and more individuals to community-based provision, and that in the data that's in the back of the report, you will have seen that there's quite a significant number of individuals, I think it's over 80% of individuals, are not returning to services. So the activities that we're undertaking are clearly having a real impact on individuals not representing. But it's still early days because we're only looking at that through a 6-month lens at this point. I'd really love to be able to come back and say to you in 12 months' time, 24 months' time, that figure's still running at that level. So those individuals who are presenting to us are actually not coming back to us, and that they're individuals who've probably gone to community-based provision as well. So it's keeping individuals away from those statutory doors. I think as time goes on and as we work closer with communities, particularly with our community capacity builders and the communities team, I'm hopeful that we can get some more robust information and data on individuals who are presenting to them and not presenting to us, which I think is what we're critically trying to shift in terms of the community's approach, is how that community can respond to that need there and then, and how we're making communities and individuals more resilient. I think as officers, in terms of the work that we do through the commission services and the core services we've got around prevention, we're measuring that now. We're measuring that, and we're seeing a lot of that positivity coming through. But for the moment, this is a work in progress. I think it's a real difficult one to see how impactful that real early intervention work is. And we've got to be mindful as well in this. If we're asking community groups to collect data and information and be sharing it with us, we've got to make sure that it's not too onerous on them as well, and that's a major issue for those groups. We've got to try and keep it as simple as possible so that we can actually get some real data to evidence the impact, but also not be expecting them to give us war and peace. and we've got to drill that down first and foremost. I think through the programme, what we've tried to do is for the first 6 months is get a system that's working and functioning well. The next 6 months will be let's tweak that and work with that. The final 6 months then, in terms of an 18-month timeline that I had in my head from the start, is very much around that at that point we should have a fully functioning system and be able to come back with a much more robust answer to that question there.
Yeah, kind of a follow-up question. Are we seeing trends in this that could be prevented by changing policy? For example, housing or homelessness risk. Could a change in the home seeker policy, for example, have an impact in terms of prevention?
I think that there's a lot of changes going through in terms of housing and homelessness at the moment, with a new bill receiving royal assent and will be enacted over the course of the next 3 to 5 years. That will change the face of how housing, homelessness and our housing allocations are done, so there will be a need to revise policy to fit with the statutory framework. I'm afraid in terms of things such as homelessness and housing, with it having that statutory footing, some of the work that's talked about in that arena around early intervention and prevention around homelessness is you've got to identify people at that early stage. Now, I think the home seeker policy is a tool to look at the allocation of social housing, but one of the things we alluded to earlier was around the expectation management of individuals presenting to us. There is an expectation that there's accommodation available and there's a plethora of it across the borough. That's simply not the case. We have a very limited resource of affordable housing in the borough. We've got limited land to develop on. We've got limited resources to do that capital investment, to develop properties as well. So there's a number of other things that factor in how we're using those resources. However, I think the work that we're doing, particularly around engaging with young people and trying to educate young people in particular through a course and programme we've set up around what's called Keys to Independence, is very much trying to get into schools and into the mindset of young people that having your own home is not easy. So presenting as homeless or losing your home where you are with mum and dad, it's not an easy route, and it's not an easy life then to go into accommodation without the resources and backing and that support and network around you. So there's a lot of activity that we're doing in that space. I think a policy change in itself will not elicit a wholesale response, a wholesale change in this arena. I think you can change law and legislation and policy and practice, but that is, in certain instances, is not going to elicit the change that we want. What we have to do here is look at the grassroots and work with communities to change that mindset in terms of how what's available, what can they expect, and what actually can they do for themselves.
Thank you.
Okay.
Okay, relating to 4.4.1 regarding the inappropriate referrals being made, how can we balance greater promotion of the provision whilst not unintentionally raising the number of inappropriate referrals?
One of the things that we're looking at doing, so the referrals at the moment are coming from other professionals or sometimes people out in the community that come across members of the public. So what we're trying to do is go out to those people who are referring in and give them a little bit more knowledge about what maybe they could do or the right places to go that maybe not the hub. Sometimes they are, you know, they might be coming to us because actually they need some statutory support. That they're fine. If they come through, we know where they need to go. It's more when they're inappropriate because maybe somebody didn't know where to signpost that person in the beginning.
Thank you. Anybody else? Oh, yeah.
Again, this is something that was discussed on Tuesday. So I think there will be a recommendation that we have a seminar regarding the awareness to all members within the council on the way to signpost, because I'm sure as members we do get issues when we need to signpost, and there are some concerns on how you signpost and where you signpost, and trying to actually get the right person to be able to deal with it. So if there is one recommendation that we can have, Chair, within this meeting, is that we have that seminar for all members. Thank you.
Thank you. Okay, moving on to Councillor Clarkson.
Thank you, Chair. Yeah, it's staying around 4.41 and inappropriate referrals. When we were having our pre-meeting discussions, we were sort of talking about sort of whether or not we had any examples of this. So can I just ask if you provide us with some further information or examples of what you mean by inappropriate referrals, and whether or not, having identified whether these are coming from specific agencies, or whether they may possibly be indicating sort of an unmet need out there, which isn't necessarily yours, but could be something that another service could offer?
Yeah, I'll pick up initially on that, and then ask Kelly to pick up on some examples. As Kelly mentioned, we are highlighting the referring agencies that are coming in. We're able to track that, pick up where individuals are probably missing the point of that referral into the hub, and where they could signpost prior to that. So we're able to identify those, and we're able to identify those gaps. The range of inappropriateness is variable, I guess, in terms of who's presenting and what the difficulties are. One of the key things, and I think it touches on the point we had, or that Councillor Hall made earlier around the seminar and the benefit of that, is one of the things we're working on is getting more information out there on what's available. So there's the Connect platform that's got the community groups, but also we're working on a community advice model through funding we've had from Welsh Government with the implementation of the housing legislation changes that have come in, to really drill down on the themes that we have within EIP, so that we've got information there for people to access, so that they can actually self-serve, so that in certain instances they don't need to come through to us, because they can, all right, okay, I can see that that is an option, and I know where to go and what to do. And in work that I've done previously in other local authorities, one of the feedback we've had from customers when we've implemented quite a robust advice model is one that they're able to see what they can see what they can expect when they're coming to the authority for advice in advance of attending, or they can actually go away and self-serve. And some of the feedback we've had from service users and customers coming through the doors is that that was invaluable for them in terms of accessing services, and also allaying fears and concerns about approaching. Because sometimes it takes a very big person to admit that they've got a problem. And that's half the battle. So I think Kelly can possibly give some examples of what we've seen on the ground then.
So in answer to one of the questions, there's definitely some agencies that are putting things through. There's a definite trend there. So we'll be targeting those to go to team meetings. Simon Rushton's doing some stuff with public health at the moment, because health is definitely one of the top ones. One example I always use, so this came from health. They asked us for support for somebody who had a diagnosis of cancer, but it had come from health. So, you know, and council shouldn't be dealing with cancer patients, that should be health. So we sent that referral back and said, we think this is more appropriate for one of your wellbeing needs, for instance. But, you know, that's just one that sticks in my brain, because I think, well, that's their sort of bread and butter. Why would it come to the council? Some of the other ones that we've had come through as well are things like a lot of the neurodiverse sort of queries. So we are, again, we're trying to signpost those to the NESH team, which is the Young Person's ND pathway. We have quite a lot of those, because I think there is an area where there is a gap. Again, that's another piece that Simon Rushton's working on at the moment, to see how we can fill some of that along with public health. Some of the other examples that we've had are where people are maybe at crisis point and they need an adult assessment, you know, so that's the other end of the scale, where actually they have to have that assessment, because there's nothing that we can do from a prevention model. Is that anything else?
Yeah, that sort of answers it, and it does identify that this is identifying gaps as well, and this partnership working is going to be important to try and fill those gaps and sort of make sure that we're not calling something inappropriate when it might be an unmet need. Does that make sense?
Thank you. Bethan, bring you in.
Yeah, just really quickly. I think it does, and I think what's important as well as part of those conversations with the partners, and as Kelly was describing that cancer one, is that they are sort of almost, they've committed to a similar sort of principle. What we need is that kind of being embedded across. So in that health example, there still could be an element where they should be considering a community response, and where maybe community can wrap around that patient, that individual in a, you know, in an informal network, wellbeing support, etc. So as well as having the conversations about what is a good referral, what is not, what is appropriate, what is not, it's also about that principle of actually there could be wider support out there that doesn't require service intervention, and sometimes that's as important as the service intervention as well. So I think that's just another element of the work that we're doing.
Yeah, thanks for those answers. It just highlights that it's still early days and it's an evolving sort of process.
Thank you. Next question is Councillor Gordon.
Yeah, thank you, Chair. We're still on 441 with the referrals issues. It says the timing of the launching of the hub coincided at the end of the academic year and therefore resulted in initial referrals being lower. Clearly, it's a new service and we can't unpick that. I'd like some colour, please, if you can, on how has the hub team worked with schools and other agencies to sort of train and raise awareness of the new processes around referrals. Thank you.
We've got we've had a lot of comms that have gone out to agencies across the board who will be referring in. We've been going across to numerous team meetings, sessions, range of organisations across the borough. That's been done by a number of different officers. So we've linked in with schools, linked in with health services, linked in with RSL partners, other statutory bodies that are there in terms of making sure that they're aware of the referral route, the referral form and the pathway in, what can be expected. And it's helped us refine some of our practices. For example, one of the things that we didn't initially have is feedback given to the referrer in terms of what the outcomes were, and we're now doing that. So that's actually closing off the loop for them. What we're continuing to do is continue to have that dialogue, continue to go out on a regular basis, picking up where we've got those particular issues, where we've got those inappropriate referrals coming in, also making sure that we're keeping it in the mind's eye of individuals, and also trying to get individuals to be aware that they can go on to Connect to access provision out in the community, and there are other universal services that people can access as well. So we're trying to stop that inappropriate referral coming in, but equally we don't want to be dissuading people from referring if they're not sure. I'd rather referral come in from an agency if they're not sure than them send it to the wrong place, because the last thing we want is somebody then to go away, not get the service they need, and then come back in 6 months' time and they're significantly more in a worse place. That's the last thing we want. So it's a fine balance, I guess, Councillor, in terms of how we do this, but we're continually going out. I know Kelly, Steph, myself, other members of the teams are continually having dialogue with professionals who are out in the community to make sure that those are aware of what the referrals are, any particular changes, and that we're making sure that they're able to access the information they need.
That's great. Thank you. It's encouraging to hear some of the signposting that's going on as well. It's really useful. Thank you.
And just to answer, Councillor, with the schools side of things, so that's completely flipped now, and schools are referring to us well. Their referrals are appropriate as well. We've got a new NEETS agenda with our coordinator, so she meets with the comp schools every half term at least. We go to the head teachers' strategy meetings as well, and we provide data with what schools are referring in, where we are then sending those children and families. We're also going along to some of the forums and things as well to look at how we can develop alongside this really good work that schools are doing around community, and how we link into that and vice versa. So I think the initial stages with schools, it was difficult, but I would say probably from around November time, it's very much switched, and they're really on board with the hub, and it seems to be going much better.
Good to hear. Thank you.
Thank you. Next question, Councillor Evans.
Yeah, before I ask my question, I'm probably have to declare an interest because I'm chair of a local hub, and a lot of the funding that's been discussed, we've been involved with. So I better declare that. I'm also involved with the two schools. You know, I'm chair governor the one, and vice chair the other. So I've got a link with all of that, unfortunately. Well, not unfortunately, but yes. My questions are more on paragraph 4.4, and it's performance information data. This information has been developed against the backdrop of shaping the model, developing the case management system, refining the data collected, and shaping how the services report on the overall outcomes in a cohesive manner. The question I got is, how are we refining the data to ensure we are capturing the most appropriate data, the information to determine the outcomes, and also the impact of interventions?
Okay, this has been a major challenge and a particular headache for us all in terms of developing the system that we have. We're using a support module that was built around our housing support grant services, and it's a referral pathway, but it records the outcomes as well at the end, so we can track people's journeys through services. What we've been able to do is refine that system so that it captures what we want in a format that we want as well. But I have to say is that when we set out, we've got a certain data set that we had that I think has been culled a little down because there was some duplication in what we were recording. And really we've been able to make sense of the processes much better and refine that against the backdrop of what other organisations have to report on and record on because of their other funders that are there. So we've had to be mindful of that. So the system's continually been revised over the last sort of 7-8 months. It's been one of tinkering, but trying to make sure that we've got it in one place. Now, I think it's fair to say that the first set of data that we pulled out was very difficult, complex. It was going across not just the core system, but also other like spreadsheets and other systems that we were using. What we've now got is pretty much most of the data all comes from one source. And that's enabling us to be more confident in what we're producing. And what we're able to do is, this does track individuals where they are in the process. We can track the times where people, how long people are with services. So, for example, if a referral's made to a service, we can see that somebody's still with that service, and we can see whether they need to be extended or not, and those requests come in. So we can track individuals through that process. We can get the outcomes at the end, and we can see where people have gone. And as I said, the data that we're collecting now will be more robust as we go on, because it's been refined to a point that's fairly sharp at the moment. It does need some further work. I'll be completely honest with you, it does need further work, but it's the same with any system. We built this up from a very basic level to one that now really functions very well, and it flows well, and we've got all agencies that are commissioned through that, using that system day in, day out, week in, week out, so we can track things from front to back. Does that answer the question?
Yeah, no, it just, after speaking to your colleague when we had a visit, there were so many complex pieces coming in. It was trying to work out how we were collating all that information in one big pile, if you know what I mean.
Yeah, the system does this very well because we can track individual needs through that. It is a very complicated system in many regards. What we're now doing, we're working with the system provider and our SRS team to actually, the best way I can describe it is to scrape the system and drop it in on a daily basis into SRS, who can then drop that into a reporting tool that reports through Power BI. So we'll have some very robust dashboards built up around the service and system that's there. So that will give us more confidence in terms of the data we have, and we'll have a greater finger on the pulse, so we won't have to run those reports. They'll be automated for us on a daily basis.
Can I just... so one of the other things to say, a lot of why we're tracking the data that we are is professional curiosity and sort of the team being very noticing, like, oh, is this anecdotal or is this actually data that we can use? So, for instance, the gaps in service, that was just a spreadsheet to start with, and then we thought, well, actually, if we can put this onto the system, that's a really robust data set then, almost to give us evidence of what's actually happening. The other thing is visitors like yourselves coming into the hub, and I'll go back to the schools. They ask us questions and we go, oh, we didn't think of how we record that, and now we've developed the system naturally because actually this is important information that makes a difference to how we are developing throughout the EIP teams, really.
Thank you. Next question comes from Councillor Gordon.
Yeah, thank you, Chair. 441 again. Targeted support services have a range of target timescales. The question is, how are the target timescales determined and by who, and is there any flexibility in these timescales?
They're very much set by the service themselves, and it's based on historic practice that they've had as well. So we use that as a baseline to start with, for example. So in terms of housing support grant services, the majority of those are around about 12 months, whereas certain other services, some are 3 months, 6 months. It very much depends on the nature of the work. We've got processes in place that then monitor that, and if services are going to overrun that time frame, there's a way in which there's a contract extension process that we put in that looks at how we extend beyond that period of time. Now, different cases, different individuals need different types of activities, and there will be differing timescales, and people's needs change as well. That the presenting need may well be one thing, but as you unpick that, like an onion, there's different layers to people's needs that are presenting. You can think it's one thing, but it actually goes on. So we're really confident that we've got these about right. I think one or two we could do with shifting, but there is a lot of flexibility in how we work in there to answer the question as well.
Thank you.
Yeah, thank you. Yeah, supplementary on that, actually. In Appendix 3, it says that the number of customers who remain in the targeted prevention service beyond this target completion date is reducing. Do you think that shows we're more effective in setting those target timescales? And I guess as a new service, we're kind of learning as we go. But, yeah, any thoughts on that?
I think there's a couple of things in there. I think the timescales have honed down. Initially, one of the issues we had was that people were not necessarily using the system as it should have been. So we were missing some of those timescales, and some of the recording wasn't as robust as it should have been at that point. And this is always the case when you develop new systems and processes and people getting used to using different IT. So each system's different. So the data initially probably wasn't as robust. I'm really confident now that we've got a robust data set in this, and we've got better oversight as a hub as to what's happening. What I would say is that people are much more focused on those timescales as well, and looking at what the exit strategies are and the exit plans are. We're doing a piece of work with one service at the moment to look at how they're measuring their exits and looking at what they're doing, where people are going, and if those exits are into community-based provision, and then tracking individuals back then to see whether they're coming back into services after that. So we're then testing that full system and model from an intervention that's there from one of the commissioned activities we have, through to then hopefully an individual accessing community provision that increases resilience, and do they come back through to us? And the critical question there is, are they coming back through to us with the same issue? If it's a different issue, that's a different dynamic there. We can't be held to account around that. If it's the same issue, then something's failing. We've not done something right. But if it's a different issue, there's a different story behind it. So the data is much more robust, and as I said, as this grows, it will get better and better and better.
Thank you.
Thank you. Next question comes from Councillor Clarkson.
Yeah, it's sort of on the back of that when we're talking about people that are not representing and that the needs have been met. Can you give us any further information, really, on how you're sort of checking in on the quality of intervention with the actual customer, rather than just the data that they haven't represented in 6 months. It was a different presentation, just to be certain that, you know, there is quality as well as just quantity within the data.
Yeah, there's a number of things that we do in this regard. We've got a number of service user groups that are set up to look at the activity to cross-reference how effective that is, how they felt supported. We also do a number of reviews through our commissioning team around the activities that we have. So we've got a work plan throughout each year that the team will go and analyse how effective those support plans are, how effective that work is. They'll deep dive into certain cases, spot check. We have regular partnership meetings with the providers, and we speak to individuals who are supported as well through that process. So there's a very robust element there with the commissioning team taking that up. But also from our perspective, we're able to actually go back and pick up conversations with individuals after they've exited support. And one of the things we're keen to do is evolve some of our services to look at how we potentially have an exit plan, and that I referred to just a moment ago in terms of that one agency, looking at that connectivity. Are they still engaged with support services in community after they've had the support and intervention is a critical one for us. So we're wanting to almost keep that, feel like a little bit of not a hold on people, not hold them for too long, let them go, but still touch base and say, are you still well? And that's built on practices that we've had within children and families, also within housing, within our resettlement service, where we rehouse individuals into properties with one of our RSL partners, and we check in with them at certain points in time to make sure that the tenancy is still running okay, and we check in with the landlord to make sure that that's running okay. So some of those principles we're starting to adopt across all those commissioned services and activities.
Yep, I think that answers my question. It's about the preventative sort of side of things. Thanks ever so much.
Thank you. Next question comes from Councillor Haller.
Thank you. Appendix 3. A number of customers from the EIP Hub who have offered appropriate community sorry, let me start again. A number of customers from the EIP Hub who have offered an appropriate community support officer. This figure has jumped significantly in February. Can you give us some further contents on the reason for this?
I'll ask Kelly to come in on this, but at the very outset, what I would say, I'll point back to the refinement of data and how that's evolved over time. So there will be some jumping in the information and an element of some inconsistency with how things were recorded, because it's been a whirlwind to get this running, and the system's changed over time. But Kelly will be able to give greater context in terms of that figure in particular, because it's been one that's been a little bit of a bone of contention as we've been evolving it, shall we say.
So from the EIP Hub, so it's definitely the data, because initially we really struggled to get our data, so we've developed the system now to actually, there's a button they tick is captured. So other things that we've set up, we have a Teams channel with all of the EIP frontline services, including the Hub. They're able to access what is out there in the community much easier. It's much more streamlined. We've got files within that Teams channel that all the workers can access. So if, for instance, a family have come in and they're looking for, say, a parent and befriending group, they can go into that file and say, there's the information, and then they can signpost. So we've done a lot of development in the background about how our triage officers can access that information much easier. We've also been sort of developing, obviously, the Connect platform, but our relationship with the capacity builders and the community connectors, they now sit in with the Hub. So we share that information between us. So when we initially came into the Hub, we weren't sure what was out there in the community. Now I think we've got a much stronger, there's still some knowledge we don't have, but it's much better than it was.
And just to add to that is, and you noticed this and you acknowledged this at the start of the meeting, that the knowledge of those officers who are working in that Hub is growing daily. I will say this in the nicest possible sense, they are very dangerous individuals. They've got a lot of information at their disposal. They've got a lot of knowledge. I think in many ways they call themselves the oracles. They're not far off that when it comes to the services that are there. And it's how we've been able to develop that approach, and how we've been able to have that singular office space where they've come together and worked together, learned off each other, and the conversations you'll hear flying around in the office. If you were a fly on the wall, you'll see, oh, I know about that service there. Yeah, have you tried this? Have you tried? And that's how we've been able to then foster that. And that's something that will only get better over time.
So in hindsight, you've been going for 12 months, thereabouts, and the work practices within the group, the hub, are getting better because you're communicating in a better way, and that's why potentially you're getting to more of a peak because of February. Obviously things happened before that have made you aware of that, and that answers my question. Basically, that you're improving every month, it's getting better because the communication between everybody is getting better, and you're getting results within the hub, and that's obviously because of that reason there. Thank you.
Thank you. Okay, Appendix 3. Average time from inquiry at front door to referral into hubs in days. The data for this measure shows average time increasing. I think we've touched on it, but have we identified sort of the reasons behind that?
So there was a period of time where we had a very high volume of referrals coming in. We were looking at about 30 a day. We also had 2 staff members down, well, you know, because obviously with the restructure there were some people that came into the hub and it wasn't for them. So they moved on, so recruitment and things. So we think that that was the initial issue, was that actually that this capacity within the hub. We've also got some waiting lists for some of our services, so that is an average. I think what we need to do, what I'd like to do, is to look at those individual services rather than just take an average. So, for instance, the homes engagement team, so for hoarding issues, they've got a significant waiting list because they can work with people up to 2 years, which is appropriate because it's a mental health issue. Whereas some of other people don't really have a waiting list and they're picking up in a couple of days. So I think what we need to do is dive into that data a little bit more about each service, but we're hoping to see that improve now over the next few months with the capacity and the team being better.
Thank you. The next 2 questions you've actually answered, Councillor Hall and my questions. Are you happy to go on to number 19, Councillor?
Yeah, sure. Or 18. Yeah. But basically, you've answered those questions. Like, yes,
I just say that Bethan's got her hand up.
Oh, sorry.
Sorry, I was just going to come in really quickly just to, I guess, celebrate some of the work that Kelly and the team are doing. So where those waiting lists do exist in terms of the signposting as well, work that Kelly is doing is around the waiting well sort of principle as well. So actually, you know, historically, where an individual would come in, would sit on a waiting list and you'd sit and you'd wait, what they're actually looking to do is actually what interim support could be put in place, even if that's really low level, whether that is something in the community that just enhances and hopefully just holds those individuals in a safer space whilst they're waiting for that referral, which I think is an asset and an additionality to perhaps what was there before. So just wanted to highlight that practice really that's being developed by the team. Thanks.
Thank you, Bethan. Councillor Hall, question?
Okay, so this is on question 4.6.1. Data provided in this report clearly shows the service is being utilised with an excess of 500 referrals a month being received on an average. My question on this, have the team got capacity to effectively support this number of referrals that they're getting each month?
It's a really good question, in the sense that it very much depends on several factors. Kelly's touched on it in the sense of if we've got everybody in, then I think that is functional. If we start to lose people because of absences for long periods of sickness, or whether this be annual leave that coincides if we're running down, that is going to give any service difficulties in operating. I think with the volume we've got, it is manageable, but caveat this against the complexity of need that we see with people coming in and the amount of time some of those calls take. It's not a linear line. Some of those conversations we have can be fairly straightforward, fairly simplistic, can be done within half an hour to an hour in some instances. Sometimes. In others, you could be spending a full day on one call. So it depends on the nature of that work. And that's something we've got to monitor in terms of Kelly's role, Steph as well as the assistant team lead, myself, and the team as well, in sort of giving us feedback in terms of how they're feeling. And one critical thing that we're fairly insistent on is that we do have the team coming in to the office, so it's not just remote, it's not remote working, they are there, they're physically there, as you saw, they were there the other day, and we can get a sense of how they are coping with the workload that's presenting. It's a tricky question to answer because there's so many multifaceted layers underneath that will drive whether we can meet those targets and continue to, and a lot comes back to what is presenting.
Can I come in there as well? So I was just going to add to that, we are trying to sort of protect the triage workers as well, because what they're dealing with day in, day out can be quite traumatic. So we've, myself and Steph are trained in sort of trauma-informed practice. So we're looking at things like we have reflection time. We do strengths-based mentoring practices as well. So the team have that opportunity to talk about some particularly difficult cases. So we are trying to sort of protect them from some of that stress, burnout side of things, working very closely to adults and children's social care with that as well, because of the practices they have in. It is a tough job. We do recognise it's a tough job, and when capacity is particularly high, you know, there are some that have struggled. But yeah, it's like you said, for us to monitor and protect them as much as we can.
Thank you. Can I just bring in Councillor Evans? I see your hand is up.
Yeah, before I go to my question, which is next, I'd like to ask, each individual worker in the hub, how many clients they were holding any one time? You know, similarly on, you know, as a social worker with so many clients, how many clients would you hold, and what would be the norm, and what would be the extreme that they perhaps need some support?
Yeah, so over Easter, it was lovely. Touch wood. We had far less referrals, so some of them only had about sort of 6 or 8 active referrals on their caseload at any one time. We have had them where they've got 30 people waiting for calls at those particularly busy times. So I would say the average we look at is probably about 15 on their dashboard at any one time. Most of those will be, they've planned their calls in, so they're just waiting to get hold of people. So that's the sweet spot, is about sort of 15, 16, and those extremes we have gone. It's very rare we get the lower ends of the extreme though, unfortunately.
So my question back onto where we were currently, we're talking about the amount of referrals that are coming in. A lot of people now within our communities use social media, and they use news to get their issues, and some people will go onto the news or they'll read up on a social media issue and go, hang on a minute, that's 1, that's 2, that's 3, oh that's me, and I need that referral. And you do see that. So there are trends going out within social media, and there are trends within news that highlight issues that are related to a community that probably weren't more on beat with it or on board with it. Neurodiversity, for example, in the last 2 or 3 years, neurodiversity, being a neurodiverse person for many, 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 many years, I've always felt that, but there's been lots more media attention to that, and there's been lots of other attention to lots of other things. So that's obviously going to give you more workload because of that's coming into the 500. So really, my question on that one is, do you kind of monitor the trends that are going outside the perimeter of your walls to see what's going to happen and when it's going to happen? And then are you in a situation to go, oh shoot, there was a big conversation about such and such, are we going to get hit with that?
We're picking up on that as much as we feasibly can. It's difficult to track everything, isn't it, these days, because things fly around at a rate of knots. But we do pick up on that. We can see the trends, and the beauty of having all those referrals coming in through that route, we can see where they're coming from. So we can track if we've got, for example, a lot of referrals in from a particular school. We know there's some activity there going on in particular, or in a particular locality. We can feed that in. So we've got that information, and we're able to interrogate that more. And like I mentioned earlier, the work we're doing with Civica and SRS to have that more robust data set and that dashboard approach will give us much more insight into what's happening alongside the anecdotal stuff. So it'll pick that up.
Again. Just myself and Steph and Lindsay, the NEETS coordinator, we sit on, for instance, the Child Exploitation Leads group, so with Gwent Police, Safeguarding for Torvine and numerous partners. So as and when trends are happening in the sort of children's world, so to speak, so things like county lines, sexual exploitation, we know some of maybe the people that might be involved, so we have the heads up for things that might be coming through. Key trends, also things like jargon that young people use. So we do have as much information. I like to think we're very good at information sharing with those other services as well. Space wellbeing is another one. So there are trends within mental health. So a couple of years ago it was around a lot of young people were self-harming to various degrees. So we had that information straight away, and the process and the policies around that then is a multi-agency approach to how we work together to mitigate some of those sort of expectations coming through.
Thank you. Can I bring in Bethan?
Yeah, and just really quickly, so I guess in terms of that sort of emerging trends and demands, yeah, us being able to respond what's coming forward is crucial, and some of that is right and is appropriate as a referral. I think it is important to just keep coming back to that point as well in terms of the long-term trend and where we're trying to get to, and that very earliest prevention. And again, there will be examples of provision that people should be able to access independently without having to refer into the EIP hub, and that is about sort of getting information out there, getting awareness out there, confidence around a growing provision. Except we're not there in all of the spaces currently, but that's the direction of travel, and that is such an important one, because the risk is potentially otherwise that's all we will continue to see is an upward trend in demand presenting at the hub, the pressure on the triage team, etc. So whilst that's a really important part of the conversation, I think it's equally important that we do keep in mind on where we're trying to get to in terms of that earliest prevention. And like I said earlier, that dual tracking really of that work that we're looking to oversee. Thanks.
Thank you. Next question, Councillor Evans.
Thank you, Chair. Mine's to do with 4.6.1. However, there are a number of early indicators that this is providing changes to how individuals within communities are being supported, and how the council is then able to track where people are going to and how are they being supported. And the question I got, how are we connected with communities to assess the impact on them in terms of increasing referrals, etc. We need to be mindful that we don't tip the balance of pressure onto community support to the point where it becomes overwhelmed. I know that firsthand, but if you can answer.
It's a really good point, and it's one that does give me a few sleepless nights in terms of putting undue pressure on other areas across the board. I think now we've got that oversight of what's going on and where people are going, we can try and track that demand that's there. And it's about having that open dialogue with those different organisations and groups that are operating within, not just within communities, but other organisations that we commission with, to make sure that they're not overburdened. And if there is a pressure point, let's try and support them through that and look at how we deal with it. And that's where we've got the resources from the community capacity team and the connectors out there, but also through our commissioning arrangements. We're going around and speaking with a number of different groups as we speak now. We're probably out and about, officers are out and about speaking with groups around what the pressures are and asking them to highlight any particular issues and needs that they have. So it helps us then look at where we can plug those gaps and where we can support them, because this is about, as I said earlier, very much about working together and working in that different mindset with communities, with the groups that are out there that are delivering on the ground, and where we can provide that support and where we can bring in support from other agencies as well. If we see particular needs coming through, can we elicit a change in response? For example, with health, actually having a presence in certain localities if there's particular health needs coming through in those areas. So we know, for example, that one of the key things we're looking at around EIP is around cardiovascular interventions, and particularly in, I think, the Cross Killiog area is particularly high in comparison to other areas. So is there a way in which we can engage with groups in that area to actually have some targeted work to try and drive down the number of people who are suffering in that way? So they're the kind of things that we need to do, and we need to be mindful of having that open and honest dialogue, and people not to be scared to raise the pressures, because that's sometimes been the case, that people are too scared to say they're not coping. And I'd much rather have that conversation with community groups to say that we're struggling, we need some help, and how do we plug that gap then, and how do we put resources in?
Thank you. Can I bring in Bethan?
Yeah, I think just to build on Simon's comment as well, you know, and some of this isn't for me even about the point of pressure, it's about that proactive planning. And actually, you know, we know there are organisations that are already stepping up to the mark, and it's a conversation around what is that capacity, what opportunities of growth have you got, and what does that look like? Because then that does foster the conversations with us as a local authority, with health, etc., to say we can genuinely deliver early intervention prevention in a way that demonstrates impact that's actually going to reduce your pressure, and therefore that's when that conversation starts to happen around leveraging resource funding in a different way, using our funding more flexibly. So for me, it's that proactive planning is almost as important as waiting for the pressure to arrive, because then it is kind of sticky plaster sometimes, isn't it, as opposed to actually, you know, you say only in what capacity, what potential have you got to grow, and how can we enable that which actually sort of delivers the whole agenda. So I think it's two strands to that conversation as well.
Yes, sorry, you've drawn me into a supplementary that I wasn't actually expecting to say, but I think that's one of the things that perhaps that's a conversation outside of this, because I'm conscious that some of the community councils are looking at, you mentioned, for example, cardiovascular and COSI is one example. So it led me to the question of actually, has there been any connection with the work that the HDRC are doing in terms of looking at needs, so that you start to see where some of these things map up, and this could be where you've got your response from?
Very short answer, yes. We're working with HDRCs on a number of different levels to get this information and build that evidence and that data set.
Thank you. Next question, Councillor Haller.
Thank you, Chair. It's my last one. Okay. The deal obviously is working around the deal, and we're talking about working with communities to improve communities. This is about 6.2. It's always been not a fear, but a thought pattern within my thoughts that are thoughts, and they continue. The groups are highly reliant on volunteers and are funded and donations on various grants and sources. My fear or expectation is, what happens if those volunteer numbers drop and the funding through grants becomes more limited or non-existent? And I say that on a positive way, because I think volunteers that we have are exemplary within our communities. They work tirelessly within our communities, and you cannot fault anybody for those volunteers. But there is a time when some of those volunteers say, I don't want to do this anymore, and who is there in the background to be able to fill that person up? And then if there isn't a person in the background to fill that person up, what happens?
We panic. No, I think there's work that we need to do to actually build up the capacity there for people to volunteer. Look at how we find routes in to encourage more volunteering. How can we incentivise it in some way without it being paid? People do things for a variety of reasons. So they have volunteered myself over the years. I've done it for a variety of different reasons. More often than not, you drop away over time, and that's the natural course of things. Your life changes, you have a life-changing event, and things alter. We've got to be mindful of that, and how can we give something back within those groups to actually make sure that they're able to sustain the volunteer numbers coming through? How can we encourage people to volunteer? So we're working on that. We're working on how we actively promote it, how we work with community groups to get volunteers in, and how we work as officers as well. I think there's work that we can do in terms of, as a council, potential thoughts that I've had is around how we can encourage our own employees who live and work in the borough to actually volunteer in different settings as part of the work that we do day to day. It may be connected to work we do, it may not be connected. Either way, there's a way in which we can help those groups survive, thrive and move on. There's also something that I think it picks up on what Beth was saying a moment ago. There's an opportunity here. When I've looked at some of the groups that are operating, a lot of them are doing similar things. And there's a lot of connectivity we can look at there and look at some collaboration and collaborative working. It shouldn't be a competition. It shouldn't be a beauty contest of who's doing the best. This should be about how we work into the most effective, in the most effective ways for the communities that we're serving. And for me, there's some fantastic opportunities and some dialogues we've opened up through conversations with TVA and through the Third Sector Major Grants Review that we're undertaking as to how we can partner with groups, and groups can partner together to deliver different outcomes and different benefits there. It's going to be a challenge, but I think it's one that we've got to sort of grab by the scruff of the neck and start to actively work with. And I know the capacity builders and the team that's running there within Simon Rushton's world in terms of the communities team are working hard to actually foster that and get that running so that we've got more and more volunteers coming through. I think we've got some great examples of how it works really well. Certainly within the play service, they've got a massive pool of volunteers. I think it works wonderfully well. We know the impact that has, and the impact then on those children that are there in terms of that effectiveness of how that's delivered. We need to get to the point where we've got something similar.
So in another room, I've been discussing this because it obviously concerns me about the amount of volunteers that happen and where we get them. In this other room, we're basically saying, if you go to a volunteer that's really happy about what they're doing, and then film them about what they're actually doing, and then broadcast the happiness, then if you broadcast the happiness of what that volunteer gets out of that position, then that's probably a way that might be useful moving it forward to actually promote what people get out of what's going on. It might be an observation, it could be a question. Thank you.
Absolutely, great idea, and these are the things we're thinking about. Yeah.
Thank you. Bethan, can I bring you in?
Yeah, just really quickly to say, and obviously critically when we're talking about volunteering, yes, we have a role for our communities team, but I think equally important is obviously TVA are there as the voluntary sector. They are the ones that, hold that volunteering agenda. So, our relationships and the way that we work with them will be critical to making this happen, aligned to the deal and everything else that's happening. So yeah, just wanted to mention our partner in that context, really.
Thank you. Next question comes from Councillor Slade.
Thank you, Chair. Hopefully I've turned my microphone on. My question concerns paragraph 6.3. It says that evidence being collected around the individual needs of residents is showing a growing picture of complexity. I wonder if you could provide us with some examples or scenarios on extremely complex presentations, and how are they being supported through the new EIP model?
Okay, I'll pick up initially here, and probably Kelly can pick up on some examples of cases that have been there currently. The benefits of operating the EIP model is that we're getting referrals into one source, and we're able to then look at a package of support that looks at numerous aspects of what the presented needs are. So it's not necessarily just going to one service area. It may be that we twin track that support around that complexity, because somebody may well have a very complex finance issue, but they also may have a significant mental health issue as well. So it may well be that given that complexity of need, we're able to put 2 support services in to actually meet that need and requirement, because it may well be quite traumatic at that point for somebody. They could be at risk of losing their home, but they could also be having a significant mental health breakdown and a significant history of mental ill health. What we're able to do in that is really coordinate and deliver better outcomes for those individuals and coordinate that work much better, making sure that we're not, if you like, letting people lose too soon and actually enabling them to access the services at the right time. What we are seeing is a growing level of complexity that touched on it earlier. As we may get a referral in for one particular need, I think this is what it is, but as somebody opens up to a support worker, they can be opening up almost Pandora's box, and within that there's several other issues that need unpicking, and we often get referrals back in that this person needs X, Y and Z as well. Complexity of need is not unique to Torvine. This is something that's across every area of Wales and the UK as well. We're seeing that this is something that's possibly being driven by multiple factors. One is life in general. Life's more complicated than it was 10, 15 years ago. COVID will have had an impact in terms of people's level of complexity and the difficulties that we face with engagement, with a number of young people presenting to us who are just literally not just not leaving the house, probably not even leaving their room. And trying to work with individuals in those circumstances is exceptionally hard. But in terms of how we're operating, we're able to actually produce packages of support that are more holistic in their approach. They're not just looking at one particular agency, they're looking at a multifaceted approach to try and get the best outcome. And we can try different things then. If it's not working, we're able to actually divert and change that support and try and then bring in other agencies that are outside the scope of EIP to potentially support that delivery as well. I don't know whether Kelly's got any particular examples that would maybe further explain that a little bit better.
Yeah, so it kind of links to themes as well, but one of the complexities coming through for families in the families world at the moment, Simon touched on it, that there's a lot of young people since COVID that don't leave their bedrooms, not necessarily missing out because their world is just online. So first of all, how do you tackle that? Because they won't engage quite often. Quite a few of those young people as well, we're seeing a lot of child-to-parent violence. So they're stuck in their bedroom, but they're also attacking their parents whenever they try to put boundaries in place. Parents are then struggling because how can they work when they need to supervise their child or young person? So then economy, there was the word, finances, that's the word. So their finances are impacted. How do they then manage the cost of living? Everything's expensive. And then if they've got siblings, it might be then the siblings are having issues because of what's going on with that family dynamic. They don't really have that support around them. They're lost within their community. They may not have family members. So the complexity for us is, where do you start? Because there it fits across all EIP themes, really, just in that one family. And I think that's the issues we're seeing more and more of those, is where do you start to unpick that thread and what do you work with first? Yeah, I think that's a good example. Does that answer it? Sort of thing we're thinking?
Yes, thank you very much. Yes, fine. Great.
Thank you. Next question comes from Councillor Evans.
Thank you, Chair. Mine to do with funding on 6.4. 6.4 sets out the funding restrictions on the service and the impact that could have. On the flip side, are we able to correlate the savings that the work the EIP hub is generating in other service areas where demand has been reduced as a result? So we need to ask, where savings are being made and what other areas. That's the easiest part of that.
Okay, I think at this point, just in terms of the savings for other areas and where we're seeing the impact, it's still too early to say whether there's a direct impact there. We know that the demand overall is increasing anyway. So we're seeing that there's an increased demand across the board for services in general. So at this point, until we get a firm baseline to work with, it's difficult to say. Again, I'm not dodging the question. I'm rather sort of painting the picture that we have. We haven't got enough data yet to be confident that that is the case. We are seeing, however, examples of where we're seeing a lower demand for some of our commissioned activity because of the approach we're taking. So one of our services that are commissioned at the minute is a very low level provision out in the community. Typically, we commission they're able to support around about 150, 160 individuals at any given time. We've seen demand for that service drop to around about 120 since the inception of EIP. Now, we could draw a number of conclusions on that. I think one of the conclusions I'm drawing here to is very much that we're diverting individuals at that low-level type of support to community services that are out there or other universal provision, when traditionally through the old routes that we would have just put them simply onto that support service. And there's some examples of that. One of the cases that's in the appendices, I think one of the gentlemen with mental health issues, where traditionally would have probably gone to that service for support, went to community services first and foremost, and that issue was averted and managed. Now, that's a real, true life example of how EIP worked and functioned. So, are we seeing some change? Yes, we are. We're seeing some material benefit on that. Can we use funding then in different ways? Yes, we can. But there are restrictions on the purse strings that are there because of the funding criteria. But we are quite innovative in how we blend that funding together then to get the right outcomes where we've got those gaps and pressures. So we're able to be quite creative with how we blend that in to make it fit the criteria. So there's ways and means in which we can shape it. I think I'd like to say that within a 12-month timescale of further operation, we'd have more robust data that would hopefully, I think, and I'm fairly confident, will show that will have driven down some of the demand in other areas. Because this takes time to embed across the piece and time to sort of adopt some of the core principles. And running alongside this, as we spoke about, is the deal. And the aim of the deal to work with communities more openly, more transparently across those 5 missions. And that's not just the communities team to do or the teams here. This is across the council as a whole. So we've got to embed some of those principles in other service areas to make sure that we're getting the best outcomes. And I think that's where we'll start to see some of the differences here. So this is almost like the catalyst for the deal to actually be moving across that movement, that change in mindset across the council as a whole. Does that answer the question, Councillor?
Yeah, so what you're saying is a lot of unknowns before you actually know the final outcome.
I'm afraid so. It's one that I can't categorically say, but there's some evidence to say that that is shifting some of the demand. But it's early days at this point.
It's less than 12 months into delivery. I think that's really important to highlight. You know, we're in a huge transformational programme of the way the council delivers early intervention prevention as a whole. Less than 12 months into delivery, I'd be surprised if we did have that clear demonstration of, you know, the impact on demands in statutory services at this point. So I think Simon's alluded to it. Some good examples, good practice. You know, the trends are pointing to the right direction, but I think it's important to caveat the context in that way.
Thank you. Councillor Slade, would you like to add to that?
Yeah, it's probably a difficult question to answer this, but you say about increasing demand. Is that because things are getting worse, or is it because perhaps people are becoming more aware of the services on offer? I'll give you an example. I worked in Great County Council many years ago, and we initiated a street lighting complaint system. And originally, we got X amount of, but then it kept going up and up and up because people were more aware that they could just ring this number, if you know what I mean. But then it leveled off. So, like I say, I know it's a difficult question to answer, but do we have a grip, if you like, on the numbers of people that need help? Or do you think we haven't peaked yet?
I think there's a number of issues here. I don't think it's down to people being necessarily aware of EIP, because it's not a self-referral route as such. There is an ability to self-refer, but it's through customer care. So there isn't a direct link into services as there was before. It comes through professionals and community groups. So individuals will need to come through somebody first to get to the service. So I don't think that's the case. I think it's just the fact that there are two things running here. The complexity of individual needs that we're seeing is across the board. We're seeing this across adults, children's, housing. We're seeing this across education services, and we're certainly picking that up now within EIP and the work that we're doing. The other thing I would say is that there are individuals within communities have very high expectations of what can be delivered and what's out there. And I think the expectation management is something that we have to get hold of. I alluded to earlier, and my background, as you well know, is around housing and housing services. The expectation is that the council will provide accommodation to individuals. Now, we've got a very finite resource, but there's a view that there's a plethora of properties lying empty across the borough and people can just walk into them. It's just simply not the case. So the expectation management of what the local authority can do and what partners can do is there. Everybody expects, again, if we put that into the health perspective and looking at it through a slightly different lens, we all expect to go and see a GP when we want to see a GP. Can we get to see a GP on the day we want? Probably not. That's about our expectation management. Now, all of us here on the screen probably understand that better than the majority of people that are out in communities. I've sat in many hospital waiting rooms, many doctors' surgeries, and the expectation of individuals at that point of call, at that point, is absolutely ludicrous. And that is something that I think we've got to try and manage better as public sector bodies. That people's expectations need to be managed in a different way, and I think that's where we as officers can do so much. I guess yourselves as the community champions, as members, can do work as well in this to manage that, and you do, I know you do that, but there's also a way in which we can get some more narrative out there about what can be realistically expected on services. I don't think we're very good at doing that. I really don't think we're very good at doing that. And I think we need to actually drive down some of that demand, because people will then actually think, well, okay, I can actually solve that myself with a bit of thought.
Thank you. Next question comes from Councillor Clarkson.
Thank you, Chair. Yeah, we've just an observation really. We've been talking about funding and community groups and duplication. Unfortunately, a lot of the grant systems actually encourage duplication from the way that they're administered. So that's something we really need to sort of think about when we're looking at the issue that I was reading around was making sure that the rationales for funding should be universally agreed outcomes and measures that can demonstrate the differences made. So what we were asking was what assurances can be given to us that the agreed outcomes and measures will also consider quality of support as well as quantitative measures. It's really important to make sure that we've got quality built in, so sorry to bring that up a few times. But a lot of the things that I've seen so far with community groups is quantity through the door that has been looked at as how successful it is and the information and the evidence that they're being given, whereas some of the smaller groups are given a huge amount of quality to the people that are actually attending them as well. So is that agreement of the assessment tools that are going to be put in place to ensure that the grant funding is getting best value for money?
Absolutely. You're talking to the converted here. It's really important to get people through the door in services, but it's the quality of that work that's done that's of paramount importance. One thing that the commissioning team have got within the work plan is very much that looking and deep diving into what those outcomes are and what people are delivering, what services are delivering, and working with community groups to make sure that they're actually evidencing the impact that they're making, but doing it in a way that's as easy as possible. It's great to know that there's 500 people going into a community group. Right, okay, that's great. So what? What are they doing? What's the difference? There may be 500 people going there, but for what purpose? What's the outcome? What's the difference it's making? It's how we measure that, and this is one of the fundamental things around the third sector major grant review and work that we're doing in this space around commissioning, is that we want to be clear on what we're trying to measure, what we're trying to get in terms of that qualitative information on the outcomes, and what's making a difference to people's lives. One of the things there that I think Councillor Hall mentioned earlier is around that narrative around how volunteers feel about volunteering. Well, it's really important to get the message across about how individuals going to groups feel about the work that's done in those groups. And that, for me, has to be the fundamental cornerstone of how we're assessing how effective some of those services are going forward. It's not the be-all and end-all, because we still got to get people through the doors. But for me, it's the quality of that and what difference it is actually making to people, how they feel about it, and how people feel about that within their community. So, right on board with that particular point, and it's something that we're building into the structures in the way in which we're working.
Thank you. Quick note on what you just said about 500 people. The women's group that I run, we've got 349 women. And about 70 that's actively engaged and actually benefit from it. So, like you said, it's all well and good having the numbers, but it's the ones that show up and engage and benefit by what you're providing. And that's 70 as opposed to the 349. But it's doing the job for the 70, and whether there was 10 or 12, we'd still be there showing up for them because they need this. Okay. Bethan, can I bring? Oh, Bethan, can I bring you in?
Yeah, just to add to Simon's point, I think that Simon is spot on, and I think just I've mentioned it in previous conversations around that corporate commitment to this agenda as well. So there is a whole work stream as a council looking at our own grant administration, the principles that we apply there. So both from a governance and an administrative process, how do we make that easier, more proportionate for the groups that are applying? And then, how do we measure the impact, isn't it? It's like you said, it's not just the engagement, it's the impact that intervention has had on the individuals, and that's where that quality lies. So that's a corporate piece of work, but it's also extended into our partners as well. So we're having similar conversations with TVA, etc., around their principles to grant administration. So then collectively, it becomes a clearer landscape. But I think it's also important to highlight, grant money is becoming more restricted, isn't it? There is less of it. So it's how we use that in a clever way as well. And again, I think that brings us back to the much earlier conversation at the start of the meeting around us being clear around those key areas of prevention, those priority areas that we are seeing, so that we can marry that up with the response then from the community. So the work, as Simon alluded to, is ongoing, and it's a priority for us as council to deliver.
Councillor Hall, did you want to come in?
Just going back on your comment, I think it's about the people that they say and the people that do. And the people that do, and the people that say don't. And how do you get over those people that say that they do? How do you get over that? People that say that they do, but they don't. But, go on, this is getting... But you know what I mean? So the people that say that they do, if they did, then we wouldn't... Then there'd be lots of people that did or do. Sorry.
We understood. Okay. Anybody else? No? Councillor Clarkson.
Thank you, Chair. Yeah, this is looking at future direction and the actions to be taken following scrutiny, and particularly around continuing to develop the overall system for referrals. There's been a lot of discussion about referrals quality, working with partner agencies, and emphasis on the fact that referrals are mainly coming from professional organisations. But there's also a certain section of people who may not be getting professional support at this point in time. And we obviously don't want to open the floodgates for inappropriate referrals. But is there going to be any work done on trying to ensure that there is a self-referral route in that people may be aware of. That's the one front door sort of aspect of providing these services going on. I know as councillors we get, these may be the type of people that approach us, that they've not got any professional help, but they're obviously in a situation which they're going to need sort of more support. So is that self-referral not through professional sort of aspect? Is that possible to be developed in any way going forward, obviously?
I think at the initial outset of the concept, it was very much around delving into the unknown. We didn't quite know how big this would be in terms of referrals. We had an indication because we've got referral routes into all those services that were there, but we didn't quite know exactly what that full volume would be. I think we've got a better handle now on in terms of what we're receiving, albeit the self-referral route isn't there. That's something that I don't think at this stage we're committing to opening up. I think it's something that we potentially may well consider, but it's been one of very much trying to develop a system, have something functioning, which I'm confident we have now, and being able to then build from there. Whether that's something that we look at going forward in the future, I don't know, but at this point the strategic direction is very much to have this as a professional route, albeit we are starting to have conversations with community groups in particular that are out there about making sure that they can refer in at that point. So we are starting to work on the premise of opening that slightly further. That may well have an impact on referral numbers, and it's something that we can then track. But it's very much around that working in partnership, because one thing we don't want to do is leave voluntary groups that are working with individuals out in the community who are potentially highly vulnerable without a route or knowing where to go to. So their conversations we've been having with different groups and started to sort of enable them to be referring in and trying to, in the same way we've done with professional in health and across other areas, to give them the training and the tools to actually try to make those appropriate referrals into ourselves.
Yeah, thanks. Just to sort of come back on that slightly, can we build counsellors into there? I know we've talked about a member seminar as a recommendation, but these are the people that we tend to get referred by a neighbour or a friend, or, you know, they don't want to, or they're fearful of approaching professionals, so they tend to come to us. So it's about us being aware as councillors and members as well that this would be a referral route that we could pick up on if necessary. And just to end the classic scrutiny question that we always have to drop in, will you be developing milestones with timescale targets for future monitoring? Obviously, that may pick up this self-referral route as well. It's all on the data, isn't it?
Yeah, certainly. In terms of the first point around members, I think that's certainly something we can consider. I can certainly have conversations with Beth Kelly and others involved in the ERP steering group about how we go about that. I think the members seminar will be a critical point, I think, because that will help to sort of crystallise some of those views around what we do, and to help manage that process if that's the route that we go down. In terms of those milestones and those key checks, definitely I'm more confident now with the data we're getting. I'm more confident with the way in which we're approaching this, that we've unpicked a number of the operational issues and we're starting to actually have a steadying of how we're operating and functioning. It's still hard, it's still evolving, it's still changing, but those milestones will be in there. So for future reporting, we'll really be able to drill down and hone in on some key issues.
Great, that's good, thanks.
Thank you. Our next two questions comes from Councillor Williams.
Yes, and this is really just an opportunity for reflection. You've done an awful lot of sharing, and you may say, well, actually, nothing more to add. But it was really what learning, as you felt, has been most apparent. Obviously, we've had quite a lot of that, but an opportunity for you, Simon and Chloe, to sort of say if you think there's anything key that, if you like, can help, if you like, in both the development of the service, but also the direction for the council. And then secondly, linked to that, what, if anything, would you change? You know, if you had a bit of a magic wand and you were able to say, you know what, we could have done that differently. So just a thought, opportunity for some quick reflection, that's all. And it's the last question.
Okay. In terms of learning, I think it's not necessarily what I've learned, but it's just re-emphasised a view that I've had for many a year, that working in isolation is not healthy, it's not good, it's not productive. What I've learned is that working in the manner we're doing, in a collaborative way, and working and respecting the views of everybody who's around that table and who you're conversing with, is critical in eliciting a change. And what we've found is that the way in which we've worked from day one, across the whole team that Beth has led, has enabled us to actually use all those skills and attributes across the board. And it's enabled us all to develop, I think, as individuals in terms of our knowledge, but also our ability to actually develop that change with a variety of agencies, and how we've been able to communicate more effectively with certain groups that are out there, how we've been able to communicate more effectively with certain agencies out there who in the past have been a little bit difficult to engage with at times. So I've learned that approach and the approaches we've taken and the skills that everybody's bringing to the table across the board, from Kelly, members of the team there, members of the other teams that I've got responsibility for, together with the teams that Beth has under her wing, has really been sort of an eye-opener. And there's some fantastic people out there. I don't think we give full credit to the quality of the staff teams that we've got at times, but I cannot sing their praises enough across the board. They make my job easier than it should be. And I think Beth would agree with that Beth's job's made easier than it should be by the teams that are there and the appetite to deliver. The learning I've taken as well from this, or I think that we've picked up on, is that nobody's got the sole answer, that the answer comes from multiple sources, and we've got to accept that individuals have all got something to bring to the table and some element of that there. I think in terms of what would I change, with hindsight's a wonderful thing, isn't it? There's lots of things I would change across the world and time, but in this particular instance, I would really have loved to have been able to hit the ground running and have a structure in place first and foremost before we'd actually embarked on EIP. We were working at such a pace at the initial phases that we were consistently evolving and changing and chopping and changing, doing things differently. And that added to a sense of a little bit confusion and almost like chaos management. It was managed, but it was a little bit like juggling balls of fire. And your fingers were getting burnt now and again. And I don't like working in that way. I like to work in a structured manner. And we didn't have that structure initially. And that, I think, is something, with hindsight, I'd rather look at a more planned approach and a more phased approach. But we've got to where we are, and we've got to where we are because of the people running the services, people operating the services, and doing what's been needed. And I have to say that the strength of character and resilience of that staff team as a whole is phenomenal. The willingness to actually make changes and work in a different way has been fantastic to see. But the structural way of doing things, I would rather have put some foundations first. So it felt very much that we were building on bamboo shoots and stilts, I think, at one point. I'd say we were rocking a bit. But I'd rather have more concrete foundations and sound foundations to build from.
Thank you. That's been quite a robust, I think, scrutiny. It's been really enjoyable, so thank you very much. Before we move on, I'd just like to check if Councillor Cross would like to add anything.
Thank you, Chair. I'll be very brief because, as you say, I was going to make that point, that this has been robust. Fair play. You really have not left any stone unturned. It was to say that I'm pleased that the HCRC got brought up in this meeting as well, because thank you, Councillor Williams. I think that having the HJRC as an underpinning element of this, it gives us a powerful tool, a potent tool within the mix. And for those people who might be watching this online, the HJRC is essentially a research unit that brings a lot of money into the authority, so that we essentially can have a sustainable research unit in partnership with the university and the health board. So it's a fantastic opportunity for us. There was some discussion about how we help communities build their resilience. This is something that I have an interest in, is how we can support them from not potentially maybe reaching capacity and then falling apart, all those sorts of things. So it was a really good discussion, and it's helpful that that informs me from yourselves. And in terms of savings, I think that, you know, you've already had a little bit of a flavour, and in fairness, the fact that this is quite a new service that we're bringing to you today. But I do think that ultimately EIP is about the long-term game, and we need to be realistic about that. The impacts that we have now on, say, a young family's life could have savings financially for many decades into the future. That's not the reason why we do it. The reason why we do it is because we want to have healthy, reaching their full potential families that are thriving, you know. But if you're looking for that financial impact, I think you have to look at it in terms of decades as well as the short term. I totally agree with Simon in terms of expectation setting. I think that is one of the key things we need to manage. I can't sort of emphatically say that more. And there was lots. This was a really good scrutiny, and I'm proud of myself for staying silent for 2 hours. Anyway, on that note, thank you so much, really genuinely. And I have a lot to consider.
Thank you, Councillor Cross. Okay, are there any officers that would like to make any summary or any comments before leaving the meeting?
No, the only thing I'd say is thank you for the questions and the insightful views that you've got. You've clearly taken on board the report, and the content in there has been really interesting to be questioned and quizzed in this way. And it's certainly been a challenge in many regards, but really good to have that interest and that insight as well, because it does give us some food for thought.
Okay, on that note, I will invite you to leave the chamber, and thank you very much. Members, can I just remind you that the meeting is still in formal proceedings and still being webcast? Can I refer you now to the scrutiny activity and invite you to offer your recommendations, and I will hand over to Rebecca, who will formulate these recommendations.
Thank you, Chair. So if I can just remind the committee of the scrutiny activity following today's discussions. So the Adults and Communities Owners Committee has been invited to review the information contained in the report, appendices, and obviously the responses to the many questions that you've posed today, to assess the impact of the EIP and the support provided by communities, to determine whether steps to further improve the EIP and support provided by communities will continue to effectively reduce the number of referrals, and then finally to make your recommendations to the Executive Member for Communities on areas for further exploration of opportunity or consideration. So if I can open up to members, if you have any recommendations you'd like to put forward.
Yeah.
I think, Councillor Hawley, your suggestion of a seminar is a recommendation would be good.
Another recommendation for me was to talk to volunteers and to get the story out into the communities about what those volunteers are doing. And that's not only a generic in this occasion, but that's a generic that we need to push out within all communities, within all the other organisations. We've got to talk about what we do within these communities. So that's probably another recommendation I'd like to see here. But it's also a recommendation I'd like to see right across the council right now about promoting the good work that our communities do.
If I can just come in there quickly. So obviously they did raise that TVA are sort of the host on a lot of the voluntary work. So perhaps tweak the recommendation in terms of working with TVA to do that. Yeah.
Councillor Williams.
Just in terms of the member seminar, I think all I would say is that we need to make sure it's after they've had a first full year of operation, so that we've got So it's a bit about timing. So I would suggest that it's after July, August.
Can I just bring on Councillor Evans?
It was me that suggested the seminar in our meeting and when we visited. So it was me that suggested that. You might have done it online, but it was me. Anyway, I would like to go back to making sure that we do get a follow-up from the future outcomes, the data, and everything that needs to be provided once the services started to bed in. Because at the moment, there seems to be a lot of outcomes that are not recorded as such at the moment. So I think something like that needs to be brought back to the committee. You know, I think next time, and needs to be put in as a recommendation. So thank you.
So, Councillor Evans, if I can just come in quickly on this. So obviously you will still receive updates in terms of the update to the recommendations you make, and then also at Visioning you will get that suite of data again so that you can review. So obviously it's within the committee's remit, gift if you want to request that to come back. So if it's okay, I'll just note that as a comment, because obviously that's within your right to ask for that back. Thank you.
And Councillor Clarkson.
Yeah, I'm not quite sure how to sort of make this into a recommendation, but it was mentioned within the questioning that we're bordering on health, we're bordering on other sort of statutory services, and sort of need to continue to develop the relationships with police, health, you know, all of our sort of allied professionals, to make sure that, you know, the appropriateness and maybe the funding issues can be addressed. But I'm not quite sure how to make that into a recommendation. I don't know, Dave, have you got any suggestions?
Well, I would perhaps just suggest that we would encourage the team to continue to develop the engagement with other agencies and use this to inform the reporting processes in relation to outcomes.
Yeah, I knew you'd put it into better words than me, Dave, thanks.
If I may come in, the point I was going to say, and I think it ties a little bit with my colleagues here, was actually the bit about encouraging that engagement with the bodies that they refer to get the feedback, but also feedback both in outcomes, but also in terms of pressure on services. Yeah. I haven't phrased that very well, but I think you know what I mean, and it was your question, I think. So, yeah.
Councillor Hawler.
So, the pre-meeting that we had and today's conversations, we were talking about the referral into the EIP. So a lot of it's coming from the professional side of it, but there is a few coming through customer services through the direct line. Now, I appreciate that the customer services operators within Torvine have got a vast range of knowledge to be able to take that information on, and what they have to do is tremendous because they've got loads of different avenues of where they're going to refer things to. But something came out when I was talking to the person I was talking to. Sometimes there might be a potential referral that needed to be referred that they didn't think that the initial person in the customer service met the criteria, therefore it wouldn't follow through. So could it be a recommendation that there was a little bit more time spent with the customer services operators?
Training, maybe?
Yeah, training, yeah, that's right, yeah. So about
I'm sure they do get it.
Training about how to actually pick up, give them a little bit more knowledge than what they've got right now to be able to get that potential refer through. There's always, I think, on Tuesday, they were basically saying that there is limited people that don't go through, but it could be the case that somebody doesn't explain the situation in the right way, is not picked up on the first initial call, and then they don't get that referral. So there's always a slit that potentially somebody could do. So you're right, Linda. I think some more training that on customer services, just to give them a bit more information to see if they meet the criteria.
Can I suggest maybe that's training across more departments than just customer services? Because obviously, even with housing, they pick up on things that may have a social background to it. Even with sort of street cleansing, that type of thing, they might pick up on things that have got sort of... So it's just awareness that of the routes and the way that we're doing things now with the early intervention programme. Councillor Evans, can I bring you in?
Yeah, I just wanted to raise about how we formulate the question to ask them now how they're going to look at making it. It's hard to explain. How is it going to be successful, and how are they going to know it's going to be successful, and what values are they going to measure to make sure that it is a success? There's no point having it if it's not working properly or one part is not working, so we need to know.
Is that about the data gathering and the reports we asked about, sort of these target timescales?
Yeah, it's a combination of all of it, if you understand what I mean. Yeah. There's lots of bits in there. If you notice, I did ask him, there's a lot of unknowns. So with them unknowns, we're not going to know whether they're successful or they're not working. So we need to ask that as some sort of formulated question.
I think that goes back to your earlier point, though, Councillor Evans, about having it perhaps come back to scrutiny in a further period. I think, to be fair to them, they're saying, obviously, it's still very early in their processes and their reporting and their refinement of the service. So perhaps I can just expand on your point from earlier about how it gets reported back to get that fuller picture for members. Is that okay?
Maybe an annual progress report, timescales, that type of thing. Councillor Williams?
Yeah, I think also in relation to that, and I think it came up when you were asking the question, Councillor Evans, is actually then what we need to see is a little bit in terms of information from other frontline teams to see whether this early intervention is having impact on the referrals and caseloads and demand within those areas. So we don't look at this in isolation, it has to be looked at as part of the whole. I think that's really what you're getting at a bit there, Councillor Evans, yeah?
Yeah.
And so I would suggest that that's one of the things there. And then, if I may, there was also the point that I think you made, Councillor Haller, which was actually specifically within the promoting volunteering, you know, using sort of, I put that highlight film, but essentially, you know, and this may be an opportunity to draw on schools' experience as well, to actually sort of have something that's visual. So I hope that's helpful.
Anybody else? No? Okay, thank you. We'll go on to agenda item 6, which is the date of the next meeting. Oh, sorry, Councillor Williams.
I don't know how appropriate it is, but when question 19 was asked about the numbers of referrals, it did strike me, was there scope to explore developing team resilience by cross-training with some of the connectors so that people could slot in on time? I don't know how appropriate that is, I don't know if it's realistic, but how to develop team resilience through shared training across teams within this part of community services, would how I'd summarise it. Yeah, it's provide greater resilience through a level of cross-training.
So talking about taking that further, we talked about the media interest and the expectations that were coming out in the press and everything else, and how they actually deal with those issues, because we're talking about 500 a month, and then all of a sudden something goes on television or something goes on the media. This is how they monitor that. So is there a question about asking them more so if they are monitoring that, or are they moving that forward? Does that make sense?
No.
Is a question that it is.
Okay, thank you everyone. So agenda item 6, date of next meeting. So thank you everyone for your attendance and contributions, and to confirm the next meeting of this committee will be on Wednesday the 8th of July at 10 AM, as well as update on the recommendations
report and the update on the Audit Wales referrals, members will also undertake the visioning session to determine the work programme for 2026 and 2027 scrutiny year. But before I bring the meeting to a close, I would just like to take a moment to express my gratitude. It's been a privilege to chair this committee and to work alongside such dedicated, supportive group of people. So, on that note, I will close the meeting.
Thank you, Chair.